Let's take this across to our reporters on the ground. I want to begin with Samarth Srivastava, who's joining us live from Lucknow. Samarth, good morning. Has the booster drive kicked off in Lucknow and in the state of Uttar Pradesh?
Well, the booster drive or this precautionary dose is the need of the hour for Uttar Pradesh, and it has begun. And now it's an important thing because Uttar Pradesh is already a home to 1.4 crore adolescents, and Yogi Adityanath has already ordered to vaccine everyone till January 15. But today what is starting is the precautionary dose because elections are nearing, and this time around those who will be on duty during elections will also be counted as the frontline workers. So it will not just be about health officials or policemen. This time it will also include those who will be on duty in villages or any polling booths. So this is a worth mentioning fact out here. Apart from that, around 7.89 crore beneficiaries have already been jabbed with vaccination in Uttar Pradesh. But what is the alarming situation for UP is the number of cases. Around 7,700 cases have been reported in Uttar Pradesh in the previous 24 hours, which is a thing to worry. Because with this number active cases in Uttar Pradesh stands around 25,000, and that is why be it CM or Prime Minister Narendra Modi, they are stressing on precautionary dose because frontline workers are the ones who are most exposed to the situations, be it the health workers in hospitals who are treating the COVID-19 patients who are not under home isolation but in hospitals, or the policemen or the ones who will be on duty during elections, because they will be the one most exposed or more vulnerable to this particular virus, and that is why it is the need of the hour. In various hospitals of Uttar Pradesh, be it Loia, be it CMS, be it civil hospital, everywhere vaccination process has begun, and it was obviously a need of the hour. But though UP is doing good in vaccination, if you took up all the numbers, but from today, the precautionary dose has started for Uttar Pradesh, who is just a few days away from the elections. It was a need of the hour, and it will be well off taken. Yes.
Absolutely. Absolutely. Before I take this across to our other reporters who are spread across cities to get your perspective on how they are gearing up for this next phase, I want to bring in Milind Sharma. She's joining us live from Delhi. Milind, one of the questions that's often been asked about this entire booster drive is whether we have adequate vaccine stock as well.
Well, that's a very good question, Akshita, because the government has clarified that we do have adequate vaccination stocks. This is why, in a graded response manner, today the government has said that they will begin giving the precautionary dose, which is the third dose, to the healthcare workers, frontline, as well as those above 60 years who are comorbid. So if you look at the number of people, there are at least 1.3 crore healthcare workers who have taken their first dose. But according to government data, only 97 lakh people have taken their second dose, and very clearly, let me also show you at the center, there are people, senior citizens, who are waiting to take their dose today, and they have registered, and slots have been booked for this very reason. But the government is very clear that only if you've taken your second dose and 9 months from that, you will be eligible to take the precautionary third dose. This applies for both healthcare workers and frontline workers as well. So those who have not taken their second dose will not be eligible to take the precautionary dose. That is a very clear mandate set forward by the government. Also remember that within vaccination centers, there is a staff crunch at the moment because a lot of healthcare workers have also tested positive, as we have been reporting for consistently some days, which also pressurizes the healthcare infrastructure, Akshita, and which is why measures have been taken within vaccination centers as well to have people who are on duty, who have tested negative and don't have the infection, so that they don't pass it on to senior citizens 60 plus who have come to take their vaccine as a precautionary dose there. Back to you.
Okay. All right, Milind getting us that live report from Delhi and breaking down details also about what are the rules and directives that the government has put forth for this phase of the vaccine drive. I also want to break down for you, if you're eligible for the booster shot, how do you go about it? Do you have to register on the CoWIN platform? Do you walk into a vaccination center? Let me explain that to you. Everyone who's already been vaccinated, if you're eligible for a booster shot, you should have 2 doses of the vaccine, which means you already have an existing CoWIN account. no new COVID registration is required. You can use the same COVID platform and you can find out your due date on covid.gov.in. Then you can book appointments online, or you can even walk into a vaccination center and you can get vaccinated. The people who are 60 plus don't need to submit any certificate from the doctor. There's a bit of confusion on that front. You can, of course, consult your doctor for advice, but you don't need a certificate mandatorily to be able to get vaccinated, confirming that you're comorbid. You don't need that anymore. That is what the government has put forth. Let me take this across to Nolan Pinto, who's joining us live from Bengaluru. Nolan, Karnataka is one of those states that have been seeing an unprecedented surge in COVID cases. 12,000 plus cases, if I'm not wrong, have been reported in the last 24 hours. So the timing of this phase of vaccination, of the booster doses being made available, is so crucial.
Extremely crucial for the state of Karnataka, especially for Bengaluru, because out of the total number of cases being recorded each and every day, about 75 to 80% or more than 80% sometime is from Bengaluru itself. Now, Karnataka had a target of 4.89 beneficiaries who are above the age of 18 who had to get the vaccine. The state health department tells us that 99% have received the first dose and 81% have received the second dose. So when it comes to the precaution dose, the state is following the 6-7-8 formula. 6 lakh healthcare workers, 7 lakh frontline workers and 8 lakh people above the age of 80 with comorbidities will receive the precaution dose. Now, this will be launched by Chief Minister Bommai at around 10 o'clock at the Vajpayee Hospital right here in the city in Shivaji Nagar. So, as of now, the deputy commissioners are working with health officials in each and every district so that this is implemented effectively.
Okay, Nolan, thank you for that update. Pramod Madhav is joining us live from Chennai. Pramod, the last time around, in the previous phase of vaccination, which had started off this year, was the teenagers' vaccine drive for the age group of 50 to 18. And in a state like Tamil Nadu, you know, the issue of vaccine hesitancy was probably one of the most crucial aspects of that phase. In this particular phase, is that really a problem, considering it's largely frontline workers and those aged above 60?
Well, the DMK government has very clearly mentioned that they are learning new aspects about how to initiate the vaccine drive. In fact, you could see behind us the chief ministers also over here, and they are initiating the booster dose vaccine drive currently. And on this auditorium itself, they have segregated. We have senior citizens, we have frontline workers, and we also have health workers at this point. Nearly 35 lakh people have been, have been identified as people who can get the booster doses, of which more than 20 lakh are above 60 category, nearly 10 lakh people of which are frontline workers, and another 5 lakh are health workers, and that way it has been categorized. And as you could see over there, the chief minister is inaugurating the event with various other events as well. This time, the state government claims that they are taking all these vaccine drives very seriously, because imagine in a period of 10 days, the numbers have gone from 890 per day positive cases to nearly 13,000, of which 50% is from Chennai alone. So the state government claims that they are taking it very seriously, and this vaccine drive will be implemented. And as you asked about the 15 to 18 years old, also the health minister has said that the vaccine drive for those children will be done as soon as possible. But another bigger issue that has been indicated by the health minister is that of the positive cases so far, almost 85% seem to be having the S-drop gene indicator, which is a precursor for Omicron spread, and that's the reason it's being said that the case positivity is too high in the state.
Okay. All right, Pramod, thank you for that update. Finally, I want to take this across to Indrajit Kundu, who's joining us live from Kolkata. Indrajit, good morning. A state like Bengal has seen such a surge in COVID cases despite a partial lockdown essentially being put in place in the state. And now with this particular booster drive kicking off, you know, there's always been a lot of politics about vaccine stock in Bengal. And the TMC government has always said that adequate stock has never reached the state from the centre. This time around, does the state believe they prepared for this phase? Apologies, we've lost the connection with Indrajit. We'll go across to him in just a bit, but our reporters are giving you a sense of what the vaccine drive looks like, and in some states it's already kicked off. As I mentioned, this particular phase is for frontline workers as well as those above the age of 60 with comorbidities. There was earlier some questions about which vaccine you can get. Now there's clarity from the government saying whichever 2 doses you got, whichever vaccine you got, that is the same dose that will be administered to you. Indrajit is back with us. Indrajit, take us through the updates from Bengal. As I was mentioning earlier, there's always been a lot of politics over vaccine supply of stock in Bengal. Is that something that's taken care of now for this booster phase?
Well, Akshita, West Bengal Chief Minister Mamata Banerjee at a program, on a virtual program with Prime Minister just a few days back, had complained that there are about 40% people in West Bengal which still requires a second dose. So it's a huge amount of population who are yet to get their second dose. In fact, we are here at a government facility, a COVID vaccination center. You can see behind me, this is of course the premier SSKM hospital in Kolkata, a government-run facility. And what we have been told here, presence out here, the booster dose drive is supposed to commence across various CVCs run by the Kolkata Municipal Corporation as well as the state government at about 10 this morning. However, we have seen very thin crowd coming in, of 1 or 2 people coming in, and they're asking for the second dose. We haven't seen people coming in, queuing up for the booster dose so far. There are about 22 lakh people in West Bengal, which the government has identified, who are above the age of 60 and has comorbidities. And they are the ones who might require the booster jab, along with frontline workers and healthcare workers at this point in time. Akshita, the grim reminder, of course, is till last night, in the last 24 hours, West Bengal has registered 24,000 fresh cases of COVID, and Kolkata alone has more than 8,000. So it's very grim at this point in time. And the booster dose is expected to give that added protection to those who already have comorbidities. Back to you.
Yes. Absolutely. Let's hope that the vaccine drive picks up pace also as the hours go by. For the moment, Indrajit, Nolim, Pramod, Samarth and Milan, thank you very much for joining us on this broadcast.